What's up? I'm Hutch, and you need to understand traumatic brain injuries so that you can better treat your patients and also pass the NPTE. A traumatic brain injury, or TBI, is basically an injury in your brain from a blow to the head. Now, this can happen in several different ways. An open injury that goes through the skull like a gunshot, or a closed injury where there's no penetration, like drowning or falling off a ladder, or a blow to the head. It can be a primary injury, like a shot, a contusion, a motor vehicle accident, which will have a coup contre coup injury, which means that the front of your head will hit and then your brain ricochets back and it hits the back of your head as well. And so you have injuries on both the front and back of your brain. Or you can have a secondary injury, which usually occurs in response to a bunch of swelling from another injury. So this can cut off your blood supply, which decreases your oxygen, which causes an ischemic injury or death of certain parts of your brain. It can also occur from pressure in areas like your subdural or subarachnoid space. These injuries are really dangerous, which is why it's important to go get some imaging done after you've had a brain injury like this, just to make sure that there isn't any swelling in those spaces, because that's going to push down on your brain and can cause you to go downhill really fast. As with all brain injuries, your deficits are going to be directly related to the structures of the brain that are damaged. So if you need a review on the structures in the brain to help you kind of figure out what symptoms or presentation you might see, take a look at these other videos. With a traumatic brain injury, you're going to have different levels of concussion. Now, concussion doesn't necessarily mean that you get knocked out or you black out for a certain period of time. A level 1 concussion means that you have some confusion and you have signs and symptoms that go away within 15 minutes. A level 2 means that those symptoms and confusion are going to last longer than 15 minutes. And a level 3 means that you lose consciousness or black out for that little bit. Now, if you're dealing with some kind of athlete who's had a traumatic brain injury, it's really important to understand your state or school's return to play protocol, and just understand that the sooner that athlete goes back onto the field, the slower that their reflexes are and the higher the risk of re-injury. This is really important to understand, because if you send that athlete back out too soon and they have another brain injury, that brain injury is going to compound on that first brain injury, and their symptoms are going to be a lot worse, a lot more severe, and a lot more permanent, and you can have really bad brain damage from this. This is called secondary concussion syndrome. So it's really something to watch out for and warn your athletes. Even though they're probably dying to get back out on the field, it's usually not a good idea for at least 7 to 10 days. There's several levels of consciousness. Ideally, we want our athletes to be fully conscious, which is alert and oriented times 4, meaning they know the person, place, time, and the situation that they're in. You may also see patients in a coma, where they're unconscious and unresponsive. A stupor, where they're only responsive to repeated stimuli. In obtundity, where they are lethargic and they have reduced or delayed responses to stimuli. In delirium, where they're disoriented, agitated, and loud. Clouded, where they have decreased attention, delayed responses, and they're quiet. Now, depending on which level of consciousness your patient has, that may alter how you decide to go about treating them. So it's kind of important to differentiate between those, especially if you're dealing with a patient in a facility where you're dealing with them a little bit more longer term. With a lot of traumatic brain injuries, you're going to have some level of memory loss as well. They may lose some retrograde memory, which is the memory of events prior to their trauma. This will usually recover to at least some extent and progressively continue to recover for a while. They may also lose some anterograde memory, which is memory created after the event. So usually when you have that traumatic blow to the head, your brain temporarily loses the ability to form and store memories. Usually this is the last type of memory to recover. Now, you can look at something called their post-traumatic memory, which is from the event, how long does it take them until they start being able to formulate new memories, and this will give you an idea of how severe their brain injury actually is. Now it's time for NPT Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. A TBI compared to a CVA has less hemiparesis and motor or sensory deficits. These symptoms are more likely to be temporary, since they often occur via a blow versus cutting off a blood supply and causing some death to your brain. And these are very common symptoms of a TBI. It's super important after a brain injury to be cautious for a while to avoid that secondary concussion syndrome, which builds on the previous concussion and can be much more severe and debilitating. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes on Etsy, or you can comment with questions or suggestions for videos I should do in the future. Otherwise, good luck studying. Go change the world.